Today I'm going to present on my case study of acute hepatitis B infection and its relation with healthcare professions. The aims of my case study is to reveal the relationship between an acute hepatitis B infection and the healthcare professions, emphasizing the importance of the complete doses of hepatitis B vaccination towards healthcare providers, and to alert people on the early signs and symptoms of an infection, especially on the acute hepatitis B infection, also the exposure on the monitoring and treatment for acute hepatitis B infection. Firstly, I'm going to make a clear view about hepatitis itself. It is an inflammatory of liver which may be temporary or called as acute or long-term, chronic, depending on it lasts for less or more than 6 months. Over time, hepatitis can sometimes resolve on its own, progress to chronic hepatitis, or rarely result in acute liver failure. It can be due to viral infection, alcoholism, autoimmune response, and toxic exposure. The transmission of different causes of hepatitis are mainly different from one another. Hepatitis B, which is my case study, is a viral infection that caused by hepatitis B virus. It only attacks the liver and can cause both acute or chronic disease. An estimated of 257 million people are living with hepatitis B virus infection, or commonly called as hepatitis B surface antigen positive. In 2015, hepatitis B has resulted in 887,000 deaths, mostly from complications of progression from chronic hepatitis B infection to cirrhosis or worse, hepatocellular carcinoma. Hepatitis B virus infection is known as an important occupational hazard for healthcare workers. My case study, a 48-year-old Malay female with a profession of a medical assistant presents at the hospital with the flu-like symptoms, nausea, vomiting, and have been losing appetite for few days. She is also presented with a yellowish of eyes with a complaint of a darker urine. She is referred as an outpatient with follow-ups and given ibuprofen to treat the fever with a blood sample sent for full blood count, total bilirubin, and urine for full examination. The next day, she complained for joint pain. Going through her past history, physician found that she has been having an accident of needle stick injury in early this year. A HIV test 6 months after the injury is negative, and she is given a dose of hepatitis B vaccination after 2 months of the injury. This patient has a surgical history of her right ovarian cyst removal 3 years back, and she has never been transfused with blood. Other family clinical history is just a positive for breast cancer of her grandmother. She is also a non-smoker and a non-alcoholic person. Considering that joint pain may be due to infection, the physician decided to send a sample for serologic hepatitis profile test. An ultrasound is also done, and the patient's liver shows a slight enlargement with normal size of spleen and no ascites is seen. The bile duct is also visibly normal. The laboratory investigation shows that the full blood count of this patient is normal. The bilirubin level in blood is quite elevated with 29 umol per milliliter. The bilirubin level in urine shows a positive result of 3+, and proceeding to liver function test showing that this patient's liver enzymes are all elevated with aspartate transaminase of 259 units per liter, alanine transaminase 265 units per liter, alkaline phosphatase 220 units per liter. Usually, AST over ALT ratio commonly measured clinically as biomarker of the liver health, and this result shows that the liver of this patient is inflamed. Proceeding with hepatitis profile testing showing that the hepatitis B surface antigen is positive, anti-hepatitis B core IgM is positive, hepatitis B envelope antigen is positive, anti-hepatitis B surface negative, anti-hepatitis C virus negative, anti-hepatitis A virus is negative. And the hepatitis B virus DNA viral load is 115,000 units per milliliter, and the INR of this patient is 1. For my discussion, I found that the patient presented with a classical signs and symptoms of acute hepatitis. The ibuprofen is given as a treatment for fever instead of acetaminophen because it can be toxic to the liver. Based on the past history of exposure and incident, she is at risk for HIV infection, but due to the clinical signs and symptoms, a liver function test is required. From the exposure of needle stick injury, she is believed to have an acute hepatitis B infection. The diagnosis is proven with the laboratory findings. The hepatitis B virus might have invaded into the body by percutaneous or mucosal exposure to the infected blood during the injury incident and before the vaccination is received. less than 5% of adults infected with hepatitis B will develop chronic disease. This patient is out of 5% that develop chronic hepatitis B. Laboratory investigation of serologic hepatitis profile tests are confirmed as a hepatitis B infection, followed by the HBV DNA viral loads of 115,000 units per milliliter. No further medications or treatment needed for acute hepatitis B infection as it is short-lived and often resolved by its own. The patient is recommended to have bed rest, well-balanced diet with all the nutrition needed and rehydration by drinking water or an IV replacement of fluids and electrolytes. An acute hepatitis B infection can progress to a severe condition or chronic infection if the INR is more than 1.5 and high bilirubin level for more than 4 weeks and up to 10 weeks. The patient shows an improvement in weight of the initial observation. Luckily for the patient, that all the indicators such liver enzymes and HBV DNA viral loads decreased within less than 6 months. A later prevention of hepatitis B has given the challenge for it to fight against the viral that has successfully invaded and replicate in the body. To sum it up, based on the clinical signs and symptoms, laboratory findings, and ultrasound made by the physician, the patient is diagnosed to have an acute hepatitis B infection. It is believed that the infection is caused by the needle stick injury at her workplace and the later prevention received. As her bilirubin levels suppressed within a short period, her acute condition is not severe or progressing to chronic infection. As a healthcare provider, it is compulsory to be vaccinated with hepatitis B vaccination. It is 95% effective in preventing the infection and the development of chronic disease and liver cancer due to hepatitis B. That's all from me, Nur Syafiqah binti Muhammad Sabri. Thank you.